These have been challenging times. We've witnessed an increased request for services overall. We noticed that anybody that had a tendency towards anxiety or depression felt those emotions even more strongly during this time of isolation, and limited comfort in terms of traveling and seeing friends and family. Our service volume has increased markedly. I think most people who have tried to pursue mental health care have run into waiting lists and lack of availability of providers. So it's been difficult, and we've seen that there's been increase in alcohol and drug use. So people are looking for ways to feel less stress and numb out a little bit. I think the unrest in the country doesn't add to the overall level of discomfort, and the lack of clarity on the national level has also contributed to a sense of being ill at ease. And we're concerned about that, so we try to do a lot of education, encouraging people to develop healthy, safe routines, to make sure that they are mindful of getting enough rest, watching the alcohol and drug intake, staying consistent with their primary care visits. Some people have let those go because they're afraid to go into waiting rooms or deal with doctors. But telehealth has been really good in that regard, that some more people are accessing their healthcare providers via telehealth, and that's the way we're doing this interview right now. So I think it's a great medium that we'll see a lot more of after this is over. Most of my mental health staff are working remotely, but we'd like them to come back in the building. So an hour ago, I had this dialogue with 30 staff members, and most people are kind of game for it. It's been 6 months. They could do the same work from home, but not only are the devices less, less advanced than they would have in the office, but there's a great value in being together with other people. So it's important that people go out, take safety measures, wear masks, but get out, get exercise, get some fresh air. The summer is winding down. We all feel it's a little cooler now, but stay in touch and take the opportunity to get out and take in a little bit of nature. I think it's really good for the soul. There were lots of articles during the summer about the value of planting a garden. So just being in touch with Mother Earth is very healthy, as well as your family and your friends. Keep in touch with them, and if you can't travel to them, stay in touch with them via video conferencing or telephone. Keep your routine. It's what keeps us focused and functioning. Don't be afraid to talk about it. There's nothing contagious about talking about hopelessness or suicide. The word in itself doesn't mean that someone's going to take action. So if you notice a change in mood of your loved one, whether they're an adult or a child, ask them. If you see a significant change in their ability to take care of themselves, make decisions, they will become more withdrawn, ask them if they're feeling kind of hopeless. Ask them if you see that they appear to not get pleasure out of the usual things they like to do. We have a fancy word for it we call anhedonia. If they have had changes in their sleep or their appetite, and again, more withdrawn, to ever think about taking their own life. It doesn't plant an idea. It actually opens up a conversation. So ask, be available. If you sense that there is a danger that they pose to themselves or even other people, keep them and their environment safe. Many people have guns in the home, so make sure that those guns, which are the most lethal form used in suicide, are secured. So keep guns out of the reach of individuals who might pose a risk to themselves. Help those individuals get connected to care. Start with your family doctor, talk to your clergy member, or call the National Suicide Prevention Lifeline. The number is 800-273-8255. And ask them for guidance on how to access care. There are hotlines of many levels, but this is the national standard, 800-273-8255. Hopefully we'll put that in a chyron at the bottom of this presentation. Once you connect them to a care provider or even a hotline, follow up with that person. It's not a one and done. This is usually many steps towards accepting help. There's a lot of shame involved with mental illness. Most of us wouldn't have a second thought about getting care for a physical injury. You wouldn't hesitate. You go to urgent care. Unfortunately, mental health, behavioral health, substance abuse are still viewed with a lot of shame and embarrassment in our society. And although there are many prominent people have come forward to talk about their own personal struggles, there still is a feeling that this is a sign of a personal weakness or vulnerability. But we have to square away this sense of vulnerability and say, this is part of me taking care of myself. I can't kind of power through tough times. And COVID has been a real test for that in terms of people's mental health sort of strength and vitality. It's been really challenging, and everybody around the world knows this. Take the opportunity to learn more about what causes a trigger. What are the triggers for you in your mental health? What contributes to you being more isolated and withdrawn? Take note of how many nights of sleep that you've missed, how much alcohol you're going through, and see those as indications that maybe you're overdoing it, and you're not caring for yourself in the way that you ought to. And get help. It usually is a very targeted suggestion around how can you take an inventory of what you're struggling with and putting together an action plan. And then a course of action. Psychotherapy doesn't mean a multi year process. Usually these are very targeted short-term interventions that can make a whole lot of difference.